Total hip replacement in Paget disease. Paget is a metabolic bone disorder, accelerated bone resorption by osteoclast and compensatory exaggerated bone formation by osteoblast, resulting in weak bone and fracture formation. Mostly Western Europe, North America, and Australia. Family history 25% is polyostatic in 83% of the cases. Etiology unknown, paramyxovirus, distemper virus, environment with high level of arsenic, in association with cats and dog. Genetic predisposition 5 to 40% first degree relative. The problem is in micro, there is osteoclast increase in size and number and leading to haphazard disorganized bone resorption. Macro, bone formed is thick, enlarged, weak, and poor quality. Viscosity is high. Marrow is filled with woven bone. The problem, the patient will be in pain, arthritis, pathological fractures, stress fractures, pseudoarthrosis, osteosarcoma risk, malignant change, chondrosarcoma, malignant fibrocystocytoma, giant cell tumor, and spinal canal stenosis. These are the bony problems which can happen. Extraosseous, high cardiac output failure, metabolic acidosis, hypercalcemia, and urolithiasis. Cranial nerve, headache, deafness, blindness, vertigo. Phases, lytic, mixed, and sclerotic phase. I will do blood investigation for the patient, that is alkaline phosphatase, acid phosphatase, to check the increased osteoblastic activity of the patient. Check the calcium and phosphate. We'll check for urine hydroxyproline and antilopeptide and collagen 1 breakdown. It is a collagen 1 breakdown marker, hydroxyproline and antilopeptide. Regarding the long bones, the problem is thick, bent, cortical thick, cancellous bones, has thick, irregular trabeculae, loss of corticomedullary differentiation, candle flame lesion, and blade of grass appearance on diaphysis. Stress fracture, it's on the convex side, means lateral border of the femur there is a fracture. Skull osteoporosis, circumscriptum, cotton wool appearance, and diploid widening. Pelvis, there is protrusion. Spine, there is thickened trabeculae and picture frame vertebra, ivory vertebra, and increased sclerosis. Regarding the treatment, give bisphosphonates, calcitonin in active phase, teriparatide contraindicated due to development of sarcoma. Preoperative, good quality films, template, mechanical alignment and offset, diagnostic dilemma of the hip pain rising from the hip or the spine. You can give injections, preoperative anesthesia, preoperative bisphosphonates, calcitonin 3 months before the surgery, increased bleeding risk, adequate transfusion should be available, cell salvage technique, pre-op donation, and hypotensive anesthesia. Pre-op surgical optimization to avoid cardiac output failure. Regarding the surgery, intraoperative femoral problems, bone is very hard and sclerotic, burrs may be needed, broaching will be needed, post-op fractures can happen, intraoperative fracture can happen, deformity of the femur in a stage, sometimes osteotomy, intramedullary cortical sclerosis, might interfere with stem fixation, cemented fixation, large canal requiring extra cement, large bone plugs. Intraoperative acetabular castration, there is protrusive acetabular, may need correction with bone graft or an anti-protrusive cages. Intraoperative fractures are common and heterophic ossification, increasing chain loosening. Mechanical access is an issue as well.